coronavirus pandemic has spread across the world, disrupting every sphere of life, socially, economically, politically, and even intruding into the spiritual domain. And the federal government of Nigeria has kicked the ground running in fighting or contracting the virus. The Lagos state government has been top-notch in the fight against coronavirus as well. Today, we have a chit-chat with Chief Medical Director at Yaba Mainland Hospital to bring us up to speed on what has been happening in Lagos as far as COVID-19 is concerned. Come with us. Coronavirus disease has gone global, causing disruptions to varying spheres of our social, political, economic lives, as well as intruding into our spiritual domain. In the wake of COVID-19 pandemic in Nigeria in February, the federal government hit the ground running towards containing the virus by first declaring total lockdown in major cities for 14 days on March 29, which was later extended to 14 days on April the 14th. Lagos state government's efforts towards containing the spread of the virus has been top-notch since the index case on February 27. In compliance with the directive given by President Muhammadu Buhari during his nation broadcast on 27th April, the state embarked on the partial reopening of our socio-economic activities on Monday, May the 4th, under strict guidelines to ensure the deadly spread of COVID-19 is adequately curtailed. Sadly, since the lockdown became gradually eased in Lagos, more cases have been recorded. A cohort blog recently caught up with the Chief Medical Director of the Yaba Mainland Hospital, Dr. Bowale Abimbola, to discuss efforts of the Lagos state government in containing the virus, to bring us up to speed on the ongoing plan to flatten the curve in the state, as well as future impacts of COVID-19 on health in general.
My name is Dr. Abimbola Bowale. I'm the medical director of this place, and this hospital is called Mainland Hospital Yaba. The previous name used to be Infectious Disease Hospital, so it's still a very popular name that a lot of people still call it. I became medical director in 2015. My educational background, my primary school was at Christ Church Primary School in Lepe. Christ Church Primary School in Lepe. I finished 1981, and then I went to Lepe Grammar School, where I finished in 1986. And from there, I went to Ogun State University, where I had my medical degree. After my first degree, I did a master's in public health, epidemiology to be precise, and then I have a diploma in family medicine from the National Postgraduate Medical College of Nigeria. So I've been managing this hospital since 2015, as I've said, and basically what we do here is to treat infectious diseases, TB, HIV, and then when we have outbreaks, like 2014, we had Ebola, and then after that we had Lassa fever, and then in the last 2 years or 3 years, we've been having cases of monkeypox, so that also became an issue. So all those cases, cholera, once there's an outbreak of any infectious disease, this is where they are brought, and that has helped us to build some experience, in terms of how do we manage these cases. So when the first patient in Nigeria that had coronavirus came, this is where the patient was admitted, and the whole response was a local response. We didn't have anybody coming from outside to actually help us. So we faced the patient, we took care of the patient, we treated the patient, and the patient was discharged when he got well. Well, as I've said that, we've been treating infectious diseases here for a while. So we've gathered some experience. When we had Ebola in 2014, we didn't have any experience on how to treat any form of infectious disease. So the experience that we gathered at that particular event, or when that event happened, actually came very handy. And subsequently, uh, we were able to handle other cases that came in, the monkeypox cases, the Lassa fever cases, because of that experience that we gained during Ebola. So when this patient also came, as I've said, the response was basically local. We handled the case here. The nurses, the doctors, the hygienists, everybody were members of staff of this place. And the reason why that happened was because we had gained some experience with Ebola. Even during the Ebola, some of our staff went to Liberia and Sierra Leone to help them in ensuring that the outbreak is contained. That also came very handy. You know that when you are in the war front, anything could actually happen. So we knew the risk we were taking as health workers. We know that the possibility of getting infected is actually there for all health workers. So uh, sometime about, I think about 3 weeks ago, I started coughing and then I had fever. So I actually went to do a test because I suspected that this is most likely COVID. And it turned out to be positive. So I was admitted, I was treated, I was discharged, and here I am today back at work. So having COVID is not a death sentence, so to say. It's not a death sentence. And luckily for us here, for most of our patients, or most patients that we see, they actually get well. So I also knew that I'll get well. Those things don't work. Those things don't work. People talk about use of garlic, use of lemon, use of all those things. Those things don't work. Don't say. A lot of people who use them still develop symptoms and they still get admitted. So we need to look for things that are validated, things that we are sure they are scientifically based and that works. If you boost your immunity, it does not mean that you cannot contract. What it means is that if you contract it, it will be mild. You may not have symptoms, or you have mild to moderate symptoms. That's why people in certain age range, maybe people in their 20s, in their 30s, in their 40s, are able to come out of it quicker than people in their 60s and their 70s. Because in 60s and 70s, the immunity has actually gone down. So these are the people that usually die from the infection. Whereas the very young people in their 30s, in their 40s, who have very high immunity, even if they contact it, they quickly come out of it much earlier. So boosting immunity will not say you won't contract, but what it means is that you possibly get out of the infection. You will spread the virus faster than somebody with very poor immunity. I think the best thing is to actually get a vaccine so that people, if they even contract it, the virus will have no effect on them. Because if you don't do that, some of the people who contract the virus will die, especially the elderly. And we don't want that to happen. For now, we have community transmission of COVID. Initially, the patient we were seeing were people who are returning from abroad and they were coming back with COVID. Some of them didn't follow the quarantine that they were asked to do. So because they didn't follow the quarantine, they spread it in the community. So today, any of us in the community could actually get COVID-19. And that's why the government has said we should all use what? Face mask. So you understand. So the symptoms are similar to symptoms of malaria. You have fever, you could have cough, you could have body aches, you could have sore throat, you could have breathlessness. Some even have diarrhea. Some, they lose the uh, taste. There's loss of taste. They can't taste things. So the symptoms are actually very, varied. And so when somebody has any of these symptoms, it is always good to check, do a test to ensure that it's not COVID the patient has.
While Dr. Bowale was responding to question on the continual increase in number of cases in Lagos despite the nationwide restriction on interstate travel with effective monitoring on people entering the country at the moment, the medical expert said community transmission is what is playing out in the figures confirmed daily. Dr. Abimbola also described the possibility of redeveloping symptoms for COVID-19 as very small because once a patient is treated for the virus, such patient is expected to develop antibodies such as IgG, immunoglobulin G, which according to him set in immediately, and IgM, immunoglobulin M, which he said serves longer protection against reinfection in the system. Only that IgM longevity in the system cannot be determined.
That possibility is very small because we expect that once you have COVID, you develop some antibodies. There's what they call IgG. That's the one that comes in immediately. And then there's IgM that is longer. So with that IgM, we expect that you have some protection for a while. But how long that protection will last is what nobody can say for now.
Dr. Abimbola disclosed to a cohort blog the current number of intensive care units available at the Yaba Mainland Hospital.
The number of beds. It's going to be difficult for me to give you the precise number of beds, but I know that here in Mainland Hospital, we have about 5 beds here. Onikon has about 10 beds. Onikon Center has about 10 beds. Etiosa, which is Landmark, has some beds. And then First Cardiologist also has some beds. And then there are private hospitals too also that the government will also accredit to work with the state government as treatment facilities. So the number of beds have been increased in terms of ICU. And in terms of the general bed too, more and more isolation centers are being built. Like here now, there's a temporary one that's being built that will have 150 beds. So the capacity is being increased every day.
A cohort blog was curious to know if there have been cases of relapse while patients on the verge of recovery and even after patients fully recovered. Here is his response.
Even for those that come in the severe in the severe form, meaning that they have difficulty with breathing, and then we have to give them oxygen and all that. Most of them, once you give them oxygen, they actually get better with time. We get to remove the oxygen and they go home. But a few people who come in very critical condition and then are sent to ICU, some of them actually pass on. But once you come in early, especially for those with mild to moderate symptoms or no symptoms at all, and we commence them on medication, about the 12th day, they are well and then they are discharged.
The medical experts described people demanding to see pictures of patients who have been treated for COVID-19 as violation to privacy of patients.
Well, I think a lot of people are aware that coronavirus is real. But some will demand for pictures and all that. It's not possible for you to put pictures of patients on the pages of newspaper or social media and they say, this person, because you'll be violating their privacy. But the hospitals are full. People have symptoms. People have died, from this same thing. So I think what the social mobilization is doing, they might need to probably expand, and then they will need to continue so that as many people as possible are reached, and then so that they will have the appropriate information. So coronavirus is real. It's not something that is being hyped.
The Federal Ministry of Health, through the Nigeria Center for Disease Control (NCDC), has prioritized testing as one of the key strategies to the COVID-19 response in Nigeria. Despite the Nigeria's COVID-19 testing capacity, which is said to have improved over the past month, the capacity is still not good enough when compared to other countries in Africa and across the world. A recent study of the COVID-19 testing trend across Africa, reported by the Cable.ng on April 22nd, showed that Nigeria was not among the top 20 countries that have tested the highest percentage of their population. Data available as of April 21st reveal that Nigeria, with over 200 million population, has only carried out less than 10,000 tests since the first case of the coronavirus in sub-Saharan Africa on February 28th. The national strategy to scale up access to coronavirus disease testing in Nigeria, produced and published on April the 15th, 2020 by the Nigeria Center for Disease Control, shows that Nigeria, as of April the 14th, has 12 functional testing facilities in 8 states, with a capacity to conduct a minimum of 1,500 tests per day in Lagos and 1,000 tests per day in the FCT and other states. Dr. Bowale said the Lagos state government is strengthening testing capacity through the expansion and enhancement of lab capacity so it can uncover more people that have contracted the virus.
The lab capacities have been expanded and enhanced. The existing laboratories, they're getting equipment that will make them screen as many people as possible in a day compared to what they had before. And then the government is also involving private laboratories, accredited private laboratories, to run those tests. So once you add the accredited private laboratories plus the government laboratories, you know that the testing capacity will definitely increase. And I'm sure, I know that in Lagos, at least one private laboratory has been accredited and is online and is working now. And I know that the process of accrediting others is also ongoing. In other states of the Federation, private laboratories are also being empowered to run the test so that as many people as possible can be reached.
When asked if the Lagos state will be testing the entire residents apart from those who have been confirmed, the medical expert said it is impossible to test the entire Lagos population.
We are not testing the entire Lagos population. We are testing people who may have symptoms or people who are contacts of people who are confirmed cases. You can't test the whole of the city.
Speaking on the Lagos State efforts with regards to contact tracing and the reported trend of residents fleeing their homes, the Chief Medical Director duly emphasized that people need to stop seeing testing positive to COVID-19 as death sentence. He identified the number of people that have been treated at the hospital, while he urged residents to submit themselves for immediate treatment once they show symptoms.
The number of people that have been treated here, I've actually done videos and they've uploaded them. You know how they survive. I remember that one former commissioner in Ogun State, Mr. Lopade, was interviewed, and one Mrs. Dafinoni was also interviewed. They gave their experience just to show that it's something that can be survived. When you run away and then you now come to the hospital late, that's when the probability of even death will arise. So there's no reason why anybody should flee their homes just because they've tested positive. But the government has actually tracked them down and then brought them to the center for treatment. But there's no reason why anybody should flee. Once you are positive, let's come to the hospital, you'll be treated, and then most of our patients actually survive, apart from the ones that come very late. We expect that when you come to the hospital, you give us proper history. That's one. Then two, if somebody is positive, there's something they call contact tracing. Right. There's a team that will speak with this person and then ask how many people he or she had met in the last 14 days. So those people he or she has interacted with in the last 14 days, the contact tracing team will follow them up, will look for them, and then follow them up to ensure that if they test positive, or to ensure that if they have symptoms, they are tested, and then if they don't have symptoms, they are left to go after 14 days. So there's a team that interviews every confirmed case and follow up people. They call them contact tracing.
On how much people at the grassroots level are informed about the realness of COVID-19 pandemic, given the purported rumor that the Nigerian government at all levels are hiking figures being reeled out on a daily basis while using the pandemic as a way to embezzle public funds. Dr. Bawale has this to say.
I think the government is doing a lot to ensure that proper information is disseminated to the public concerning coronavirus. The government is using the radio, is using the television, even social media to communicate to our people. And there's a pillar in the EOC. EOC is the Emergency Operations Center that the Lagos State government set up. And we know that Mr. Governor is the incident commander. So there's a pillar in the EOC that what they do basically is to engage with the public. They call them social mobilization. So they go to communities to educate them about coronavirus. They go to markets. They meet people. They do town hall meetings. They put jingles on the radio and on TV so that people can be aware that this is real. The hospitals are full. People have symptoms. People have died, from this same thing. So I think what the social mobilization is doing, they might need to probably expand, and then they will need to continue so that as many people as possible are reached, and then so that they will have the appropriate information. So coronavirus is real. It's not something that is being hyped.
Here is his response when asked on whether the federal government took the right decision or not by easing lockdown in Lagos, Ogun, and FCT, which took effect on Monday the 4th, particularly in Lagos, given the fact that cases have tripled since lockdown became eased.
It's going to be difficult to say. There are experts who actually work on this issue of lockdown and all that. So I'm sure they had examined it properly before the federal government was advised to actually ease the lockdown. The only thing I know that the easing of lockdown has done for us now is that there are more traffic. So for our ambulances bringing in patients, it's not as fast as it used to be when there was a lockdown. When there was lockdown, they could go 4 or 5 times to bring in patients. But now with this lockdown now, if they are able to do 2, they'll be lucky. Apart from that, whatever the government says is actually based on what the experts have advised. So if they say tomorrow that we need to do lockdown again, then I'm sure the government will do the best. For the patient that we admit now, there are a cocktail of drugs that we give to them. One of them is an antiviral drug. And then we discovered that people get well on this medication. By day 11, day 12, they are discharged. Most of them will have tested negative. And this is working for us.
Start taking the antiviral?
Yes, antiviral. Once you have been there, we give them the cocktail that contains an antiviral medication. And they get well. By 12 days, 11 days, 12 days. In fact, the average length of stay in our hospital is about 11 to 12 days. People turn negative and they are discharged. Though I know that there's also plan to do some experimental study using chloroquine or hydroxychloroquine, and that will commence very soon. But for now, we have an antiviral drug that is effective, that we use and is working.
Responding to a cohort blog whether the Lagos State government has it in plan to carry out research on local herbs as treatment for COVID-19, the Chief Medical Director confidently guaranteed that the Lagos State Traditional Medical Board must be doing some research on herbs that could be used in treating COVID-19 in the state. Dr. Bawale said government is doing so much to flatten the curve through continual awareness, including the policy of social distancing, mask wearing, frequent hand washing, as well as prompt reporting of cases for immediate treatment, among others. At the time of this report, about 320,000 people have died of coronavirus worldwide, while leaving over 4 million people infected. The COVID-19 pandemic is an unprecedented challenge on the world health, and it might be around for a while, just as WHO recently warned that COVID-19 may never even go away. Therefore, we may have to prepare for what is ahead while keep cognizance of the coronavirus as it continues to spread. Make it a priority to stay safe by keeping social distance, frequent washing our hands thoroughly with soap and water, and of course with alcohol-based hand sanitizer. Let's not forget to always cough or sneeze into our elbow or into a tissue with immediate disposal. Avoid touching your eyes, nose, and mouth. Clean surfaces and objects you touch often. Zainab Yakin reporting for EcoHot blog. All right, that has been the interview with the Chief Medical Director at Yaba Mainland Hospital. It's been a very enlightening one. You can always go to our website at www.ecohotblog.com for updates on COVID-19 and our other news updates on there. And also do follow us across our social media platforms, Instagram, Twitter, and YouTube at EcoHot Blog.